My name is Marcus Mason. I'm a medical physician. The full name of my company is Marcus Mason MD PA, Advanced Wound Care, and the business address is located in Miami. These days, I spend most of my time working as a full-time practitioner in the field of wound care. But I also have a few other hats. I perform internal medicine, family practice, and I'm also a certified geriatrician. I graduated from college from the University of Miami down in Coral Gables as a pre-med student, attended the University of Miami Miller School of Medicine. After that, I attended Alton Ochsner for my internal medicine residency for 3 years, then came back home to Miami to do a 2-year geriatric fellowship at the Miami VA Hospital and Jackson Memorial Hospitals. Advanced Wound Care has been operating for nearly 3 years now. The services that Advanced Wound Care offers mainly center on providing bedside wound care in nursing facilities, assisted living facilities, and private homes. And that entails assessing the wounds and performing any necessary procedures. With my service, I actually make a house call to the facility or the home, and I'm treating the patient at home, and therefore they don't have to worry about being transferred out. The major risk factors that affect how patients heal in regards to their wounds have to do with whether they're diabetic, whether they are malnourished, and their ability to turn and reposition themselves. The most rewarding and satisfying part of working in the medical field really has to do with being able to assist patients and their families in not only feeling better, but particularly with wound care, actually having the opportunity to heal the wound. If that's not possible, then always giving a reassuring sense to the patient and the patient's families in terms of what I'm doing. I've published several works in my medical career, and these include topics varying from internal medicine issues such as endocarditis and certain medical conditions like Paget's disease to specifically addressing wound care. The most important thing that I've learned as a medical professional is patience. Everyone has different attitudes and personalities, whether that's from the patient in particular or their families or your colleagues, and you have to deal with everyone in a laid-back and relaxed way in order to attain your goal, which is doing the best for your patients. I feel the most important thing to know about geriatric care is the saying that we learned early on in medical school, which is start low and go slow. Geriatric patients have reduced metabolism, and they process medications and different drugs in a slower way than younger people. So that is an adage that is extremely important when you're addressing the elderly population. A typical day in terms of my company, Advanced Wound Care, visiting a facility basically involves being notified which patients have wounds. Generally, the majority of them will be a follow-up, so I will have already seen the patient, evaluating that patient's history from the chart and doing a physical examination. Entailed in the physical examination is a full assessment of the wound on that date, so measuring the length, width, and depth of the wound and describing the wound base is all important in the proper assessment. I'm very excited about the prospects for Advanced Wound Care. Right now, I would like to expand the service. There is a great need for thorough and competent wound assessment in the community. And so what I'd like to do is bring other clinicians on board with me, whether that be doctors, nurse practitioners, or physician assistants. The particular areas I'm looking for right now are South Florida, Central Florida, and areas in Louisiana and Georgia. My proudest professional accomplishment has been going independent and starting my own company. Entailed in that is the opportunity to work on my own and provide services from a holistic point of view in terms of helping patients. This has been a great inspiration to me and a great motivator in helping others.